In this video series, we will be discussing about the biomechanics of the vertebral column. So by the end of this series, we will be able to understand the introduction or the typical vertebrae, about the intervertebral disc, about the different articulations present in the intervertebral column, and what are the different ligaments and joint capsules present in the intervertebral columns, and what are the regional differences, kinetics and kinematics of your cervical spine, kinetics and kinematics of your thoracic spine, kinetics and kinematics of your lumbar spine, and kinetics and kinematics of your sacral region, and what are the different effects of injuries, and what are the different effects of aging over the intervertebral column. So coming to the introduction, so the basic skeletal system has been classified into two different regions or two different parts. That is the axial skeleton and appendicular skeleton. Axial skeleton consists of 80 bones and appendicular skeleton consists of 126 bones. So your vertebral column will be coming under the axial skeleton. And next is the different terminologies or relative locations or region within the axial skeleton. So first terminology is your posterior, that is synonymous to your dorsal, and that is defined as the back of the body. So anterior means ventral, that is defined as the front of the body. Medial, that is defined as the midline of the body. Lateral, that is divided away from the midline of the body. Superior, synonymous with the cranial, that is defined as the head or top of the body. Inferior, that is the caudal or tail part, and that is defined as the bottom of the body. So coming to the introduction of the vertebral column, the vertebral column resembles like a curved rod and composed of 33 vertebrae and 23 intervertebral discs, and it has been divided into 5 different regions. That includes your cervical region, which consists of 7 vertebrae. Second region is your thoracic region, that consists of 12 vertebrae. Third region is your lumbar region, that consists of 5 vertebrae. And fourth region is your sacrum, that is fused, and that consists of 5 vertebrae. These 5 vertebrae will be in a fused manner. And fifth region is your coccygeal region, that consists of 4 vertebrae. Similar to your sacral region, these 4 vertebrae in the coccygeal region is also in a fused manner. The vertebrae increase in size from the cervical region to the lumbar regions, and then decrease in size from the sacral region to the coccygeal regions. So this means that higher compressive load or compressive stress will be over your lumbar region because of the increased size of the increased size of your vertebral bodies as well as your intervertebral disc. So these are the different regions of the vertebral columns. The first region, that is your cervical region, that consists of 7 vertebrae. Second region is the thoracic region, otherwise known as dorsal region or dorsal vertebrae, which consists of 12 bones. And third region is your lumbar region, that consists of 5 vertebrae. And fourth region is your sacral region, that consists of 5 vertebrae that in a fused manner. And fifth region is your coccygeal vertebrae, that consists of 4 bones that too in a fused manner like your sacral vertebrae. So coming to the curves, primary and secondary curves of the vertebral columns, there are 2 curves, that is the primary curves, so that retain the original posterior convexity throughout the life. So that is known as the primary curves. So that primary curves includes your thoracic curve and the sacral curve, whereas the other 2 curves, that is the cervical and lumbar, that shows a reversal of the original posterior convexity, that is known as they are concave in structure, that is known as secondary curves. So primary curves includes your thoracic and sacral region, and your secondary curves includes your cervical and lumbar region. And the curves that have a posterior convexity and anterior concavity are referred to as kyphotic curves. So primary curves is otherwise known as kyphotic curves, and the secondary curves is otherwise known as lordotic curves, because in lordotic curve they will be having posterior concavity and anterior convexity. So you can see here in cervical and lumbar region they will be having posterior concavity and anterior convexity. But in the thoracic and sacral region, they will be having anterior concavity and posterior convexity. So this is the difference between the primary and secondary curves. So coming to the typical vertebrae, the structure of a typical vertebrae consists of two major parts that includes your vertebral body and the vertebral or neural arch. The vertebral body is designed to be the weight-bearing structure of the spinal column. In order to minimize the weight of the vertebrae and allow dynamic load bearing, the vertebral body is formed by a shell of cortical bone surrounding a cancellous cavity. So this is not a solid block of bone. So this is just a shell of cortical bone surrounded by a cancellous cavity. The cortical shell is reinforced by trabeculae in the cancellous bone, which help resist the compressive forces. The compressive load appearing on the vertebral body or vertebral column has been resisted by this particular structure that is known as the trabecular system in the cancellous bone. So this is the part of a vertebral column, that is a typical vertebrae. So it includes your vertebral body and classified into neural arch. So the entire typical vertebrae has been classified into two parts, vertebral body and the neural arch. The neural arch is further classified into pedicles and posterior elements. The posterior elements is again classified into lamina, transverse process, spinous process. So all these processes. So this is the trabecular system or the internal architecture of the vertebral body. So or the vertebral column. The various trabeculae are arranged along the line of force transmissions. This particular trabecular system are responsible for maintaining or controlling the compressive forces acting on the vertebral column. So this is the vertical trabecula of the vertebral bodies are arranged to resist the compressive loading. The neural arch is again further divided into pedicles and the posterior elements. The functions of the pedicles is to transmit the tension and bending forces from the posterior elements to the vertebral bodies. Pedicles increases in size from the cervical to lumbar regions. The remaining posterior elements are the lamina, articular process, spinous process, and the transverse process. The lamina are centrally placed and serves as an origination point for the rest of the posterior elements. The lamina are thin, vertically oriented pieces of bones that serves as the roof to the neural arch, which protects the spinal cord. In addition, the lamina transmit forces from the posterior elements to the pedicles and through them to the vertebral bodies. So lamina will be transmitting the forces from the posterior elements to the pedicles and finally to the vertebral bodies. So it acts like a bridge for the force transmission. So this force transfer occurs through a region of the lamina called the pars interarticularis. So pars interarticularis is a region situated or located in the lamina that will be helpful for force transferring from the posterior elements to the pedicles to the vertebral body. The pars interarticularis is the portion of the lamina that is between the superior and inferior articular process. So by the name itself, interarticularis. So it is located by the name itself. We can able to find that it is located somewhere in between the superior and inferior articular processes, and they are subjected to bending forces that are transmitted from the vertically oriented lamina to the more horizontally oriented pedicles. They are most developed in the lumbar spine, where the forces are greatest in the magnitude. In the typical vertebra, the spinous process and two transverse process are the sites for muscular attachments and serve to increase the lever arm for the muscles of the vertebral column. The articular process consists of two superior and inferior facets for articulation with the facets from the cranial and caudal vertebra, respectively. So coming to the intervertebral disc, the intervertebral disc has two principal functions. First function is to separate the two vertebral bodies, thereby increasing the available motions. So this intervertebral disc is responsible for increasing the range of motion within the intervertebral joints. And second function is to transmit the load from one vertebral body to the next. So it acts like a shock absorber and it resists the compressive loading over the intervertebral body. So therefore, the size of the intervertebral disc is related to both the amount of motions as well as the magnitude of the load that must be transmitted. So the intervertebral disc, which makes up to 20 to 33% of the length of the vertebral column, it increases. The intervertebral disc size will be getting increased from the upper region to the lower region. That is the cervical region to the lumbar regions. That means in the cervical region, the intervertebral disc will be small comparing to the lumbar region. Whereas in lumbar region, intervertebral disc size will be higher or more because of the increased weight bearing or the increased loading of the lumbar region. The disc thickness also varies approximately 3 mm in the cervical region, whereas the weight bearing loads are the lowest, to about 9 mm in the lumbar region, where the weight bearing loads are highest. So the cervical region only 3 mm in this thickness is there, and comparative to the lumbar region, because the weight bearing is highest in the lumbar region. So in lumbar region, the disc thickness will be 9 mm. The intervertebral discs are composed of three parts, namely nucleus pulposus, annulus fibrosus, and vertebral end plate. Nucleus pulposus is a gelatinous mass, whereas annulus fibrosus is a fibrous outer ring, and vertebral end plate is a cartilaginous layer covering the superior and inferior surface of the disc, separating it from the cancellous bone of the vertebral bodies above and below. So this is the coronal section of the intervertebral disc, and this is the transverse section of the intervertebral disc. So in this, you can able to see the outer annulus fibrosus, inner nucleus pulposus, and the vertebral end plate on both the upper and lower sides of the intervertebral disc. So nucleus pulposus will be in a gelatinous structure, and this will be in a thickened-like structure. That is the annulus fibrosus. Coming to the nucleus pulposus, the nucleus pulposus is 70 to 90% of water, depending on the age and time of the day. The proteoglycans make up approximately 65% of the dry weight and have the ability to attract water molecules because of the presence of glycosaminoglycans. Because of the presence of glycosaminoglycans, they are having high water content. Collagen fibers contributes to about 50 to 20% of the dry weight, and it is also composed of collagen, contrastides, elastin fibers, proteins, and proteolytic enzymes. The nucleus pulposus has both type 1 and type 2 collagen, in which the type 2 collagen are more in the nucleus pulposus. And the nucleus pulposus has been frequently likened to be a water balloon. So it is almost similar like a water balloon. When compressed, it deforms, and the increased pressure stretches the walls of the nucleus pulposus in the all directions. So during compressive loading, because of the increased pressure in the intervertebral disc, this nucleus pulposus will be stretching. The walls of the nucleus pulposus will be stretching in all directions, in all the four directions. So this is the loading. So you can able to see this is the normal intervertebral disc, and this is the intervertebral disc during an axial compression, in which the nucleus pulposus is loading in all the direction or compressing in all the directions. Next part of the intervertebral disc is the annulus fibrosus. In general, the annulus fibrosus is 60 to 70% of water, like the nucleus pulposus, depending on age and time of the day. Collagen fibers make up to 50 to 60% of the dry weight, with proteoglycans contribute only 20% of the dry weight. Clearly, the relative proportions of this component are different from the proportions in the nucleus pulposus, reflecting the difference in structure. So annulus fibrosus is almost like a dry weight, and nucleus pulposus is almost like a watery structure. The remainder of the dry weight is made up of approximately 10% of the elastin fibers, such as the fibroblast and the chondrocytes. Type 1 and type 2 collagen are present in the annulus fibrosus. They resist greater proportions of the tensile forces. So annulus fibrosus is responsible for resisting the greater portion or the greater proportions of the tensile forces. Next part of the intervertebral disc is the vertebral end plates. The vertebral end plates are layers of cartilage that is around 0 to 6 to 1 mm thick. The vertebral end plates consist of proteoglycans, collagen, water, and cartilage cells. There is a higher proportion of water and proteoglycans closest to the nucleus pulposus, and a higher proportion of collagen closest to the annulus fibrosis, and the subchondral bone of the vertebral body. The cartilage of the vertebral end plates is both hyaline as well as in fibrocartilaginous in structure. So that means the vertebral end plates consist of both the hyaline cartilage as well as the fibrocartilage. So hyaline cartilage is present closest to the vertebral body and is found mainly in the younger age groups. And fibrocartilage is present closest to the nucleus pulposus, and with increasing age, this becomes the major components of the vertebral end plates, with little or no hyaline cartilage remaining, reflecting the need to tolerate high compressive forces. So during the younger age, hyaline cartilage is present, and once the person is getting age or increased age, the fibrocartilage will be the composition of fibrocartilage will be predominating with the hyaline cartilage, and during your aging process, so the fibrocartilage will be more. So that is responsible for tolerating the high compressive forces over the vertebral column. Coming to the innervation and nutrition of the intervertebral discs. So they are innervated in the outer 1/3 to half of the fibers of the annulus fibrosis. In the cervical and lumbar regions, the intervertebral discs are innervated by branches from the vertebral and sinovertebral nerves. The sinovertebral nerves also innervates the peridiscal connective tissues and specific ligaments associated with the vertebral column. The intervertebral discs do not receive blood supply from any major arterial branches. The metaphyseal arteries from a dense capillary plexus in the base of the end plate cartilage and the subchondral bone deep to the end plate, and the small branches from these metaphyseal arteries supply the outer surface of the annulus fibrosis. So the outer surface of the annulus fibrosis is supplied by your metaphyseal arteries. The remainder of the disc, so except the outer surface, remaining part of the entire intervertebral disc receives its nutrition via diffusion. Coming to the articulations of the vertebral columns, there are two main types of articulations found in the vertebral columns. They are interbody articulations. That is a cartilaginous type of joints that is located between the two intervertebral bodies. And next articulations is the zygapophyseal articulations, otherwise known as apophyseal articulations or facetal articulations. This zygapophyseal or apophyseal articulations is otherwise known as facetal joints. These interbody articulations is known as intervertebral joints. And this zygapophyseal or articulations or apophyseal articulations is a synovial type joints. Synovial joints also are present where the vertebral column articulates with the ribs, with the skull, and with the pelvis at the sacroiliac joints. So coming to the first articulations, that is the interbody joints. So these available movements at the interbody joints includes your sliding, distraction, compression, and rotations. Rotation is otherwise known as tilting or rocking motions in the spine. Sliding motions occurs in the following directions, that is anterior to posterior sliding, medial to lateral sliding, or torsional sliding. Tilt motions can occur in anterior to posterior directions or in the lateral directions. These motions, together with distraction and compression, constitute of 6 degrees of freedom in the interbody joints. The amount of each of these motions are small and vary by region according to the structural differences in the disc and the vertebral bodies, as well as the ligamentous supports. In addition, the apophyseal joints influence the total available motions of the interbody joints. The next articulation is known as the zygapophyseal articulations. These are composed of the articulations between the right and left superior articular faces of a vertebra and the right and left inferior faces of the adjacent cranial vertebrae. The zygapophyseal joints are diarthrodial, that is, the synovial joints and having regional variations in structure. The structure are most likely involved in protecting the articular surfaces that are exposed during flexion and extension of the vertebral column. Next, coming to the ligaments and joint capsules of the vertebral columns. The ligament system of the vertebral column is extensive and exhibits considerable regional variability. The six main ligaments that are associated with the intervertebral and cyclophysial joints includes your anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, interspinous ligament, supraspinous ligament, and intertransverse ligament. So first is the anterior and posterior longitudinal ligament. The anterior longitudinal ligament and the posterior longitudinal ligament are associated with the interbody joints. That means they are attached in between the two intervertebral bodies. The anterior longitudinal ligament runs along the anterior and lateral surface of the vertebral bodies from the sacrum bone to the second cervical vertebrae. From the second vertebral to the occiput, it will be continuous or extended as the anterior atlanto-occipital and the anterior atlanto-axial ligaments. That means the extension of this ligament, extension of the anterior longitudinal ligament above the C2, second vertebra, second cervical vertebra, is known as your anterior atlanto-occipital and anterior atlanto-axial ligaments. The anterior longitudinal ligament has two layers like your posterior longitudinal ligaments, and that are made up of thick bundles of the collagen fibers. So these two layers includes your superficial layer and the deep fibers or deep layers. The fibers in the superficial layers are long and bridge several vertebrae, whereas the deep fibers or deep layers are short and run between single pairs of vertebrae. So that means your superficial layer will be connecting the several vertebrae, and the deep layers or deep fibers will be connecting single vertebrae. The deep fibers blend with the fibers of annulus fibrosis and reinforces the anterolateral portions of the intervertebral disc and the anterior interbody joints. So these deep fibers later will be blending with the fibers of the annulus fibrosis and reinforces the anterolateral portion of the intervertebral disc as well as the anterior interbody joints. So this anterior longitudinal ligament will be increasing in thickness and width from lower thoracic vertebrae to the L4, L5, S1 vertebrae. The tensile strength of the ligament is greatest in the higher cervical, lower thoracic, and the lumbar regions, with the greatest strength being in the lumbar region. It is reported to be twice as strong as the posterior longitudinal ligament. This is one of the important points because in extension, this is the only ligament that will be helpful for protecting the intervertebral column. So this anterior longitudinal ligament is twice as strong as the posterior longitudinal ligament. This ligament is compressed in flexion. During flexion, this ligament will be getting compressed, and during extension, this ligament will be getting stretched. So it may become slack in the neutral position of the spine when the normal height of the disc is reduced, as might occur when the nucleus pulposus is degenerated. So this particular anterior longitudinal ligament will be slack in the neutral position. So this is the diagrammatic representation during your flexion as well as your extension. During flexion of your spine, you can see here the anterior longitudinal ligament is getting compressed and your posterior structures will be getting stretched. So similarly in extension, the anterior longitudinal ligament will be getting stretched and preventing the excessive and hyperextension of your spine. So this is the only ligament that will be working during the extension. So that is the main reason why this anterior longitudinal ligament is twice as strong as the posterior longitudinal ligament. Coming to the posterior longitudinal ligament, it runs on the posterior aspect of the vertebral bodies from C2 to sacrum. Anterior longitudinal ligament has been running from down to bottom, that is from the sacrum to second cervical vertebra. But in posterior longitudinal ligament, this will be running from top to bottom, that is from the second cervical vertebra to the sacral region, and forms the ventral surface of the vertebral canal. It also consists of two layers, that is the superficial layer and the deep layer. Superficial layer fibers spans or getting attached with the several vertebrae in the deep layer, these fibers extend only to one adjacent vertebrae, interlacing with the outer layers of the annulus fibrosis and attaching to the margins of the vertebral end plates in a manner that varies from segment to segment. Superiorly, this ligament becomes the tectorial membrane. So the extension of your posterior longitudinal ligament above the second cervical vertebra is known as your tectorial membrane. So that will be running from the second cervical vertebra to the occipital region. In the lumbar region, this ligament narrows to a thin ribbon that provides little support for the interbody joints. The posterior longitudinal ligament is stretched in flexion and slack in the extension. So in this diagram, you can able to see here, during flexion, the posterior longitudinal ligament along with the other ligaments will be getting stretched, and during extension, this posterior longitudinal ligament will be getting slack. Next ligament is your ligamentum flavum. The ligamentum flavum is a thick elastic ligament that connects lamina to lamina from C2 to sacrum and forms the smooth posterior surface of the vertebral canal. Some fibers extend laterally to cover the articular capsules of the facetal joints. From C2 to occiput, this ligament continues as the posterior atlanto-occipital and posterior atlanto-axial membranes. This ligamentum flavum is strongest in the lower thoracic region and weakest in the mid-cervical region. Although the highest strain in this ligament occurs during flexion, when the ligament is stretched, this ligament is under constant tension even when the spine is in a neutral position because of its elastic nature. Since this contains a higher elastin component, ligamentum flavum is elastic in nature. So this highly elastic nature serves two purposes. First purpose is it creates a continuous compressive force on the disc, which causes the interdiscal pressure to remain high. The raised pressure in the disc makes the disc stiffer and thus better able to provide support for the spine even in the neutral position. Second purpose is a highly elastic ligament in this location is advantageous because the ligament will not buckle on itself during movements. So because of the highly elastic component in this particular ligament, this ligament will not get buckled during the motions. If the ligament did not buckle on itself, it would compress the spinal cord in the vertebral canal, especially without any movement into flexion. So next ligament is known as your interspinous ligament. That means in between the spinous process, adjacent spinous process. The interspinous ligament connects the spinous process of adjacent vertebra. It is a fibrous sheet consists of type 1 collagen, proteoglycans, and profuse elastin fibers. The interspinous ligament, along with the supraspinous ligament, is the first to get damaged during the excessive flexion or hyperflexion activities. So you can able to rewrite it as like the function, like this is the during hyperflexion or excessive hyperflexion will be prevented by this interspinous ligament and the supraspinous ligament. So this is the main function of this interspinous ligament. The interspinous ligament is innervated by the medial branches of dorsal rami and is thought to be a possible source of low back pain. So once the interspinous ligament is getting weak, means you may cause the low back pain. So this is one of the culprit for your low back pain. The interspinous ligament has been found to contribute to the lumbar spine stability, and this interspinous ligament will be getting degenerated with aging. Next ligament is your supraspinous ligament. It's a strong cord-like structure that connects the tips of the spinous process from the 7th cervical vertebrae to the L3 or L4 vertebrae. The fibers of this ligament become intestine in the lumbar area, where they merge with the thoracolumbar fascia and the insertions of the lumbar muscles. In the cervical region, the ligament becomes the ligamentum nuchae. The supraspinous ligament, like the interspinous ligament, is stretched in flexion, and its fibers resist separation of the spinous process during forward flexion. During hyperflexion, the supraspinous ligament and the interspinous ligament are the first to fail. So like I already mentioned in the previous slides in the interspinous ligament slides. The same function during hyperflexion, both these ligaments will be getting damaged. The supraspinous ligament contains mechanoreceptors, and deformation of this ligament appears to play a role in the recruitment of spinal stabilizers such as multifidus muscles. Next ligament is your intertransverse ligaments. So that means the ligament that gets attached in between the transverse process. One transverse process to the another transverse process. The structure of the paired intertransverse ligament is extremely variable. The ligaments pass between the transverse process and attach the deep muscles of the back. In the cervical region, only a few fibers of the ligaments are found. In the thoracic region, the ligament consists of a few barely discernible fibers that blend with the adjacent muscles. In the lumbar region, the ligament consists of broad sheets of connective tissues that resemble a membrane. The membranous fibers of the ligament forms the part of the thoracolumbar fascia. The ligaments are alternately stretched and compressed during the lateral bending. The ligaments on the right side are stretched and offer resistance during lateral bending to the left, whereas the ligaments on the left side are slack and compressed during the motions. This diagram you can able to see. This is the left lateral bending or left lateral flexion. In this, during left lateral flexion, the right side intertransverse ligament will be getting stretched, and the left side or the movement towards the concave side, the concavity side intertransverse ligament will be slack. So this is how the opposite side. So during lateral flexion to the left side, the ligaments on the right side will be preventing the excessive lateral flexion or the excessive lateral bending of the spine towards the left. So this is the ligamentum nuchae. So this is one of the prominent ligament. So next one is the zygapophyseal joint capsules. The zygapophyseal joint capsules assist the ligaments in providing the limitations to motion and stability for the vertebral columns. So this means not only your ligaments is providing stability to the particular intervertebral column, your joint capsules or your fascial joint capsules are also responsible for limiting the range of motion as well as providing the stability to the vertebral columns. The role of the joint capsules also vary by region. In the cervical spine, the fascial joint capsules, although lax, provides the primary soft tissue restraint to the axial rotation and lateral bending, but they will provide little restraint to the flexion and extension. So in the cervical spine, this particular joint capsules will be restricting the rotation motion as well as the lateral flexion motions, but they also provide restrictions to the flexion and extension, but in a minimal manner. The zygapophyseal joint capsules on the lumbar spine, in addition to the annular fibers, also provide primary restriction to the axial rotation, but those on the thoracic spine do not. The capsules are strongest in the thoracolumbar region and at the cervicothoracic junction sites, where the spinal configuration changes from a kyphotic to lordotic curve and from a lordotic to kyphotic curve respectively, and the potential exists for excessive stress in these areas. So in these two different region junctions, like your thoracolumbar junction as well as your cervicothoracic junctions, since there is a change in the spinal configuration from this particular kyphotic to lordotic curve or from the lordotic to kyphotic curves, so these particular capsules are strongest in these particular junctions because of the excessive stress occurring in the particular regions. So these capsules are more strong in the particular junction sites of the vertebral column. The joint capsules like the supraspinous and interspinous ligaments are vulnerable to hyperflexion, especially in the lumbar regions. So during the hyperflexion motions, these particular ligaments, supraspinous ligament and the interspinous ligaments, is the first one to fail along with your joint capsules. So all these ligaments as well as your capsule will be responsible for preventing the excessive hyperflexion motions in the lumbar spine. It has been suggested that the joint capsules in the lumbar region provide more restraint to forward flexion than any on the posterior ligaments because they fail after the supraspinous and interspinous ligament when the spine is hyperflexed. So when the spine is hyperflexed, these two ligaments will be first getting failed, and after that, these joint capsules will be getting failed. So these three structures, the joint capsule, supraspinous ligament, and your interspinous ligament, is the primary restraints of for your hyperflexion, or in another sense, the hyperflexion will be prevented by these particular three structures. By this, we are concluding part 1 video of the biomechanics of the vertebral column. In the next video, we will be discussing about kinetics and kinematics of the vertebral column. Stay tuned. Thank you for watching this video. Please do subscribe and share this to your friends. Thank you.